Good afternoon, everyone. First of all, I would like to briefly introduce myself. I am Sasitorn. You can call me Sasi for short. I work as a lecturer at the Faculty of Physical Therapy, Mahidol University, Thailand. My specialty field is PT in the community, and I would like to thank you very much for having me in this international webinar series. If you have any question during my session, please send them to my email at the end of this session. Well, I would like to give you an overview of this session. We are going to talk about the health system in Thailand to give you some important information that could help you to understand the context and link to the community work of Thai PT. Then we will move to the role of PT in Thailand, which we have been targeting to 5 different age groups. Next, we will get into the PT role in the community. I would like to share some part of PT work in an intermediate care and long-term care. Then, I would like to give you a series of essential tools, which most Thai PTs in the community know and use it. There are ICF model, community-based rehabilitation, and the 7 community tools. Finally, I will present the case scenario in the community and share some other work and projects in the community. About the health system in Thailand, the health system is operated by the Ministry of Public Health, and the Thai health system can be roughly divided into private and public health system. The public health system can be separated into 3 levels of care unit. And there are a lot more hospitals that are run by the government, such as the military hospitals, university, and the Red Cross. For the private setting, we have several private hospitals, clinics, and home services. Focusing on 3 levels of care units, it consists of primary care, secondary care, and tertiary care. To give you more details and see the difference of each type, the type, size, and care will be explained. The primary care will organize mostly in health promoting hospitals, which are the smallest unit of the healthcare system, and community hospital. As a side, we will talk about the number of beds. Primary care will take care only outpatients, not longer than 24 hours. If patients need more time to investigate or treatment, then need to refer to the secondary care. The health promoting hospitals are operated by non-medical and medical staff. The doctor is temporarily available in this type of hospital. And most work goes for health promotion and prevention. Each sub-district has this kind of hospital. For the secondary care, there are a community hospital and general hospital, which contain around 10 to below 500 beds for inpatients. There are at least 1 to 2 general physicians or family medicine and or other medical professions in community hospitals to take care of common problems. These hospital types are set in each district and city. If patients need further special investigation and care, they will be referred to tertiary care. As a tertiary care, it provides excellent center and specialty hospital, which contain more beds than secondary care and more subspecialty professions, such as cardiologists, cancer, or neurosurgery, and geriatric. They are providing more complex care and treatment and some special investigation. Most tertiary care is provided for each province and state. So, the role of PT in Thailand by the roadmap of MOPH or the Ministry of Public Health. One, physical therapists have to take care of at least 30,000 people in their area. PT should take care within 5 different age populations, which are baby, age 0 to 5 years old, and pregnancy. School age 6 to 14 years old. Teenager age 15 to 21 years old. Workers age 15 to 59 years old, and elderly aged from 60 years old, and people with disability. Physical therapy should provide 4 main works, including health promotion, health prevention, treatment, and rehabilitation. Then, what is the different role of PT in the community? As a role of PT in community, firstly, we have to prepare our patient to live in their home well. PT need to work with family care team, which including family medicine, nurse, dentist, occupational therapist, pharmacist, and more, to work in the intermediate care for evaluating and getting prepared the patient from hospital to home, such as the treatment, training, assistive device, which fit with their home. And then we also have the long-term care as we go to follow up the patients in the community. Sometimes patient and their family struggle when they get back into their real situation. So PT needs to work with the patient family and caregiver. Moreover, PT should know well about the organization for both formal and informal in their community and work together with them because the organizations can provide some beneficial tools and support for our patients. Our goal is to create the sustainability for patients to live well in their house and with society. Then, there are 3 essential tools to help PT to work well in the community. There are the International Classification of Functioning, Disability, and Health, or ICF model, Community-Based Rehabilitation, CBR, and the 7 community tools. First, I will talk about the ICF model. It is a tool for the classification of health and health-related domains. There are 5 dimensions related to health, which are body function and structure, or impairments, activity, participation, and the contextual factor, which are the environmental factor and personal factors. For the environmental factor or personal factor, it can have the facilitator or barriers, which we have to analyze and talk with our patients to find it. The benefit of the ICF model, it is all of this dimension is the holistic approach, and These two can help us to assessing the complexity of functioning and disability. I think you all already know about the ICF model. So we will go to the next. It is the community-based rehabilitation CBR that was first initiated by the World Health Organization in 1978. And it is the strategy to improve the access to rehabilitation services for people with disabilities. It consists of 5 components that are health, education, livelihood, social, and empowerment, and their associate elements at CBR metrics. As the CBR metrics, I know that you all already work and learn about the health box of health that are contain promotion, prevention, medical care, rehabilitation, and assistive device. I'm sure that you all know about this domain well. Moreover, in other domains, which are education, livelihood, social, and empowerment, we need to provide this support to our patients or people with disabilities. It doesn't mean that PT need to do all of this. You are not the Wonder Woman or the Superman, but we need to find and know the right person or organizations to work with and who can support the process and also the materials. So you may think that how you can find and know these people or organizations. These servant community tools can help you to find the right people and organization in your area. I'll briefly describe every tool. First, it is geosocial mapping. As you see from the picture, it can present the location and structure of the area and also show the social activity, which can describe in the map, and also relationship using the line symbolic. Like in the purple one, you can see the relationship of the patient to the place that they go or the other house that they related with. Somehow, you can show the negative relationship. We are using a wavy line. This can help you to understanding and localize your targeting population. Secondly, the genogram, or you may know as the family tree. It can help you understanding the complexity of family relationships and may find some genetic disease which may occur in families. Genogram represent the family relationship by blood and by marriage or adoption. The triangle means the male and circle show the female, and the double line show that they are married or stay together as a couple. The third is a community organization. We will find our local organization for both formal and informal. And understanding the community organization can help you find the right people and organization to enhance your project for patients or developing society in the right direction. This is the informal people who run the village to help the patients as a health volunteer. And this guy is architecture who help in the design for the patient. These all are the formal staff, such as the nurse, such as the other official government officer. So when you know the relationship, you can show as a symbolic like this, that this is the relationship between the village mayor, district chief officer, sub-district headman, the wives association, or maybe the informal leaders. You can know what about the relationship, is it good or bad? And it can help you to run your project well or run the changes in your society well. Okay, for the fourth is the local health systems. These two will show you not only the modern medicine, but we can also see the traditional medicine which people in the community use to cure their illness, such as some herbs or trees. This picture is Indian gooseberry. Most people use it for soothing their sore throat. This leaf is used for reducing the high temperature from fever. The baby jackfruit is used as a product for drinking and body care. So the local health system doesn't show only the medication usage in the community, but they also collect information such as beliefs and cultural activity related health. For example, people in northeast of Thailand believe that people joining ghost dancing will get better from illness. So some of the stroke patients in the northeast commonly go or join into the ghost dancing event. Then for the fifth is the community calendar. It will give you information about the cultural and economic activity. Then when you know all the activity through the year, PT can plan the appropriate time to run the activity or program, or you may match your project with the local activity. For example, this is the community calendar. In this column, it shows the event and activity. And for the row, it shows the month of the activity. And in the north of Thailand, there are an activity to play with a ball after finish the crop period and celebrating the new year. This activity will provide the time for teenagers and encourage them to talk and play the fabric ball together. If PT would like to work with this population, we can connect with them by this activity. The sixth, it is the local history. It can give you an understanding of background of the people in the community, not only the patient, but also the organization. Lastly is the life story that will bring you connected with the people and understanding them deeply and see the potential of that person. Such as this lady, she is a caregiver for 15 years already, and she very creativity for the assistive device that I will show you later. So the benefit of the 7 community tools, these two is the first step that will help you to easily contact and establish the rapport with people in community and give you an overview of the community for a short time. This tool is uncomplicated data to use for explanation in details and work together with medical or non-medical staff and organizations. These tools can help you to finding the potential person and organizations to work and collaboration with. Next, we will go to the case scenario, which represent how PT rehab the patient in the community. I met this patient in 2018 during a survey in the community. At that time, he aged 29 years old. He lives with his family, including his father, mother, and younger brother. His parents were an employee in the prawn farm. He was a fieldwork electrician before having an accident. 8 years ago, he fell down from the tree during working with the electrical line. His buttock was first contacted to the ground with both legs extended in the same position as in the picture. The operation and medication were given. He got a 20 centimeters surgical line on his back. He was discharged after a week in the hospital. He trained himself to sit upright for a month. At that time, he got both lower extremity weakness and loss of sensation. The next year, he cannot move well on the bed. The traditional medicine and massage were given by suggestion from his cousin. However, after a month, he did not feel better and decided to stop the intervention. So from 2013 to 2018, he did not go to the hospital. He trained himself with support from his brother to move from bed to the toilet by using a wheelchair to transfer. He spent his life mostly in bed. He got on a wheelchair only for going to the toilet. His family prepared the food for him nearby his bed. You may think that why he did not go to the hospital for rehabilitation. A health promoting hospital should be located nearby. What happened to him? I will give more information later on. By the physical examination, he got spinal cord injury at T12, incomplete cord lesion. This is his bed mobility and gross motor function in 2018 when he sat on the edge of the bed. His BP was dropped and he got orthostatic hypotension. And after he training for a month, he had getting better from it. This is mostly the first trial of his standing. You can see that there are a lot of support. You can see that he was in an unstable, cannot well control his body. His trunk is moving forward, and you can see that the floor is still unlevel. It's covered with the stone and soil. Then we will have a look at why he did not go to the hospital. This might be one of the impact factors. The environment. You may see from the outside of his house, it is very far away from the city. It took around 1 hour away to the general hospital. Although the health promoting hospital was nearby around 20 minutes, at that time, it doesn't have a PT or a doctor available in this type of hospital. One more important thing is how hard he could bring himself out of the house. You can see that inside his house is narrow and not suitable for a wheelchair to move freedom elsewhere except moving from bed to wheelchair. This is inside his house, and this is a surface and the kitchen area. This is his wheelchair that he used, the only one wheelchair that he had. to the toilet. And it is where he and his family sleeping and sitting around here. This is his bed. You can clearly see the surface that is covered with the stone and soil and unlevel. This mat, I bought it. It can help him to be more stable on the surface. This is an example of the ICF model of this patient. We could see the health condition. It is spinal cord injury, T12, incomplete cord lesion. An impairment is the orthostatic hypertension, which already getting better, and he was recovered from it. Then is both lower extremity weakness, both hip flexor and gastrocolic shortening, fast static standing balance with walker, impair and lost sensation in the lower extremities, hypertonia in both lower extremities. About the activity limitation, he got the difficulty in standing with walker. A participation restriction is he cannot go outside by himself to see his friends. As the environmental factor that you see, it also have the barrier and facilitator. For the barrier, it is untidy and uneasily accessed in-house for wheelchair. And you can see the unlevel surface. For the facilitator, the bed and wheelchair are in the same level, and he has the supportive family member and caregiver. For the personal factor, he had very good cooperation. For the barrier, he also had a hypertension, but can be controlled by the medication, and also low economic status. As you can see from this ICF model, this can help you to analyze and find what is the impact factor that you can move it to cure your patient or help him to improve his activity limitation and participation restriction. By this ICF, you can see that what is the important factors. It is the impairment and the environmental factors. If we can move and change to these two boxes, we can facilitate or boost the activity or getting change in the activity limitation and to the participation restriction. Let's see his progression during couple years. In the November 2018, after training for a month, he can stand with leg support and he can move independently to the edge of the base, as you can see from this video. He can move independently by himself and well controlled to the edge of the bed. Yeah. And after talking with his family that he have the potential to walk by using a walker, it will be better if we can have a level floor surface for him. And after that, only a week, they find a material to construct a new floor. As you can see, the new floor in the December, the surface was changed already. Is very level and smooth. Let's see his sit to stand. Yeah, you can see that he can standing by himself with supervisors and how well balanced that he can control himself. And then he also have a plan to have a walking training. We have planned together that because now he can stand very well and good control. So we will move further to the walking training. And in the November 2019, after a year of training, that you will see his standing task is more stable, more faster and stable, well control of the position, not much lean forward of his trunk. And now he can walk independently and well control in turning by using the walker. He learned to well control about making his step and turning. This is turn. He tried to turn himself. Yeah. This is narrow turning, and he can control well. Then another walking. You can see that if he have the supervision, he can walk faster and faster. He still have some problem of the confidence during he walking. He's still like a bit fear of fall. Okay, and then this is his progression in the June 2019. I have trained him together during between the walker and also the Canadian crutches. You can see how he stand in June and January 2020. He can standing in well control and the position is upright and straight up. Yeah. So you may ask that, what is the next to move forward with him? Can we discharge him right now? But no, we still have to work more for him, as you know from the CBR matrix. Now we give him about the health, the dimension, all of the dimension of the health, but he also need to finding the channel for a job and life with society. So when he get a job and can spend his life with society, then the PT can phase out or discharge. That is the sustainability that we try to work on it and collaborate with other people and organizations. Now we are in the final section, that is other works and projects in the community. There are some health promotion and prevention that PT work in the community. That is the project that it is elderly caregiving skills development for the migrants during and after the COVID-19 pandemic, which is sponsored by the International Organization for Migration. So you can see that not only 5 different age groups that we work, we also work with the migrants who will be affected to the elderly, because these migrants, they are taking care at the home care for the elderly. Some of them also work in the industry, and some of them also work in the hotel. If they have the knowledge, so we can prevention some disease such as the COVID-19, because the topic that we're giving to them is the personal hygiene management for infection prevention. It's about how you can wearing a mask, how they can cleaning their hands. Moreover, we also give them the knowledge and training about the bed activities and positioning for older dependent people. We have a training during the bed mobility, the bed positioning, sitting positioning, and how they can move the patient or the elderly. Last session is the training and lifting techniques for older dependent people. At this session, we will give them a knowledge and training about the wheelchair, how they can move it forward, backward, or tilting it, or getting upstairs and downstairs. These skills is very useful for the migrant who work in the hotel. Then it is another project that is the health promotion and prevention for elderly school. Nowadays, the elderly population is projected to grow more and more every year. There is an elderly school, which firstly happened by the empowerment of health promoting hospitals or community hospitals in each sub-district. The group of old citizens then lead the direction of the school by setting the school principal and committee. They will ask the member about the topic which they needed to learn. For example, they would like to know how to prevent from falling. They will ask PT to give them knowledge and willingness to follow the intervention for prevention. In some schools, they will ask PT to generate the topics. These pictures show that each area needs different health information and intervention, such as some elderly school need the knee osteoarthritis exercise, some need to improving their balance, and some would like to know more about diabetes prevention or the exercise to reduce the blood sugar in the diabetes patient. Sometimes the topic is not only about the health. It can be any other topic such as finance, job, or hobby, depend on their need assessment. This picture is the school, which is sponsored by the government. And it is the sub-district government that support this building and area for the elderly to use it. This is the principal of this school, and this is the nurse who was in the health promoting hospital. This is other government officer that runs the school together. Some areas they need the exercise for the diabetes. Some need the knee osteoarthritis, as I told you, and some need other topics. Lastly, it is the health promotion and prevention for the prisoner. We also getting in the prison and taking care about the pregnancy and babies, and also the physical fitness testing and health consultation. You can see that we have the screening and the fitness testing, cardiovascular fitness testing, flexibility, and also abdominal curl. Then for the innovations, PT can collaborate with the architects in the project of design for rehabilitation. This man got a stroke on his left side for almost 8 years. He always stays and does all activity on the floor. Because of a chronic condition, we found a shortening of hip flexor and hamstrings and knee clonus, and also the weakness on his lower extremity and also the left arm. Then we take his function to move to the stool. And can he stand? You can see how he moved down to the stool. His right leg have some strength, but not much strong. But his right arm is very good. So he still need the support when he go down and also go up to the stool. And we gonna see how he standing. Could he stand? Because it is a community setting, so the tool were developed to assist the patient to stand at the appropriate level. As you see this tool, you can adjust the rail up or down for the patient to fit with the level of the patient. You can see this video that this is his first trial of his standing. We use a lot of people surrounding him because it is his first time. He sit on the stool, and the stool is this 12-inch, and he can stand up by support on his back. Okay, can see it again. Can stand up from the stool with the moderate assistant. Okay. And then after a month of training to go up and down on the stool that is the 12-inch, we developed the tools, as you see, to enhance his skill in his daily living, to sit at the appropriate level, not only on the floor. We design the level of this, like the stool, the double level of the stool. The level of this stool is 12-inch that we training him. So you can see that how he can use this tool. Can move up. Not in a good control, but he got better because he can do it independently. It seemed like he trained around 3 months with the stool, and we developed this tool for him. And then you can see that he can sit at the appropriate level of seeing things, and he can weight it on his both legs. So now he can sit and do other tasks, which with great training in the next level as standing and maybe walking. So you can see that the tools are not needed to be complex. It could be simple, function, and fit for our patient. However, this tool is only the prototype. When this tool was used, the right side of the patient should be on the wall. The right side of him should be on the wall. And we will set up a rail for the standing training. Okay, we will go to the next is the innovation that from the caregiver creativity. It is not needed to create only from the PT. The caregiver can create and initiate these tools. If you can remember the lady that I showed you in the life story, she has been a caregiver for her mother, who is bedridden for 15 years. She can move only her neck and both upper extremities. Every day, this lady needs to move her mom up and down and other bed mobility, such as the changing diapers by herself every day. She also got the severe back pain by doing this. Then she thought about how to move her mom legs and have a better care of hygiene and also save the cost of diapers. So she has an idea about making a hole in the bed for urinary and defecation. The tray is made to fit with the hole without the space. When she wants to remove them for cleaning, she can use this trolley to bring it out. So she can save her bag and no need to climb under the bed to get the tray. Moreover, she also creates the table for her mom that will give her mom more stable and eating the meal by herself. Then these photos, it is the tool for stretching the gastrocnemius muscles by using the coconut shell. You can stand here to stretching the gastrocnemius muscle, or maybe using the wood like a slope, stretching it. Therefore, PT is not the only one who creates innovation. Other people and organizations could help you to facilitate your work or the improvement of patients and society. You need to provide the best of your information, knowledge, skills, suggestion, and support for them. That is all of my session. This is the reference that I used in this session. I hope you all can see and know more about physical therapy in the community and also receiving the idea and concept of the community rehabilitation. And I would like to thank you very much for your attention. And if you have any question, please send to my emails. Thank you.